Hi everyone, welcome back. If you are new, please consider subscribing. My name is Yari and I create educational videos for beauty professionals in training and for those who like to continue learning. You guys, in today's video, we are going to be going over the top skin diseases and disorders that are commonly questioned on the state board test. This will be a two-part series. This is part 1. If you find the information helpful, don't forget to give this video a thumbs up, share it with a friend, consider subscribing. Feel free to find me on all social media platforms as Glam and beyond. I hope you stay with me until the end of this video. Now with that said, let's get started. Number 1 on my list, I have acne. We know that acne is an inflammatory skin disorder of the sebaceous glands. In other words, oil glands. It is characterized by excess sebum production. The excess oil and dead skin cells can plug the pores, creating comedones, papules, pustules, and cysts. What are open comedones? Open comedones are blackheads. They are oxidized with oil plus debris at the skin surface. Closed comedones, on the other hand, are whiteheads that are trapped under the skin. Papules, they are red inflamed bumps with no pus. Pustules, on the other hand, are inflamed with visible pus. Nodules or cysts are large, painful, deep lesions. Now, they are different forms of lesions. Now, remember that any mark, wound, or abnormality is described as a skin lesion. There are 3 types of lesions: primary, secondary, and tertiary, which are known as vascular lesions and involve the blood or circulatory system. So what are primary lesions? Primary lesions are the first early changes that happen in the skin. They are the starting point of a condition. So for example, a macule, which is a flat spot or freckle or lentigo, that will be considered a lesion. Papule, we know that papules are small, raised bumps, like a pimple but without the pus. Pustules are inflamed, pus-filled bump, pimple with the pus, right? A vesicle is a small blister or like poison ivy or cold sore that can be described as a vesicle. The term bulla is a large blister or like a burn blister. A nodule is a solid lump or like deep acne. A cyst, we know that it is a sac with fluid or pus. A tubercle is a large abnormal solid lump. So all of those are examples of primary lesions. Now let's talk about secondary lesions. These develop later from damage, healing, or scratching of a primary lesion. So what would be some examples of a secondary lesion? A crust, which is like a scab, right? Dried up blood. Excoriation, you guys, is basically any scratch mark. A fissure is a crack in the skin. An example will be chapped lips, chapped hands. An ulcer is an open sore with pus or tissue loss. Keloid. A keloid is a thick raised scar that doesn't heal quite properly. It tends to heal over the skin versus under. Keloid. Scale will be flaky skin such as dandruff or psoriasis. And of course, I did try to find some pictures for you guys to give you a better visual. Now let's go over tertiary, also known as vascular lesions. These involve the blood vessels. Examples would be telangiectasia, which are dilated broken capillaries, also known as spider veins. Next we have varicose veins, which are enlarged twisted veins often on the legs. Next, rosacea, which is a chronic inflammatory skin disorder characterized by persistent redness and visible capillaries. Cause: exact cause is unknown, but linked to genetics, vascular issues, and immune response. Flare-up triggers would be heat, sun, spicy foods, alcohol, caffeine, stress, and extreme temperatures. What does it look like? What are some of the appearances and symptoms? Well, like I said, chronic redness, especially on the cheeks, nose, and forehead. Again, it has visible dilated capillaries, which again are known as telangiectasia. May include papules and pustules that look like acne but are not acne. So don't get that confused. In advanced cases, thickening of the skin on the nose can occur, and that is known as rhinophyma. I say we keep the good vibes going. Number 2, it's dermatitis. It is a generalized term. So again, dermatitis, the term dermatitis is a generalized term to refer to an inflammatory condition of the skin. Some of the forms include lesions like eczema, vesicles, or papules, but remember that dermatitis has many forms and symptoms. So let's go over a few of these that are very commonly questioned on your state exam. Contact dermatitis versus atopic dermatitis. So contact dermatitis is a skin reaction caused by direct contact with an irritant or allergen. Cause can be external triggers, okay, such as chemicals, cosmetics, detergents, fragrances, nickel jewelry, plants like poison ivy, for example. Onset, so appears when the skin touches a specific substance, okay? Symptoms would be redness, itching, swelling, blisters, dry or even peeling skin. So key exam points to remember is that contact dermatitis is not inherited. It's caused by something touching the skin. Atopic dermatitis, in the other hand, something like eczema, is a chronic inherited condition. Cause could be genetics plus immune system plus environmental triggers. So onset often starts in childhood, tends to flare up and then calm down. Symptoms would be chronic dryness, intense itching, inflamed patches, often on the bends of elbows, knees, face, neck, and hands. Key exam points to remember: that atopic dermatitis, it's a long term and it is linked to family history of allergies. And here's a quick visual, and yes, this looks like it hurts. Number 3, seborrheic dermatitis. It is a chronic inflammation of the sebaceous oil glands that show up as flaky, scaly, itchy skin in oily areas. So, what are some causes, or what is the cause of seborrheic dermatitis? Well, overactive sebaceous glands, often linked to a yeast on the skin, can flare up with stress, weather changes, or immune issues. What does it look like? What's its appearance? What are the symptoms? Well, can be yellowish or greasy scales, redness and itching, found in oily areas such as the scalp, okay, hairline, eyebrows, sides of the nose, ears, chest. In infants, it is called cradle cap. Key exam points would be that seborrheic dermatitis, it's chronic but is not contagious. Estheticians can help manage mild cases, okay, by gentle cleansing, exfoliating, and soothing treatments. Severe cases obviously should be referred to a physician. How to remember it? Well, seborrheic, think sebum, oil. Look for oily, flaky, yellowish scales in areas with lots of oil glands. Seborrheic dermatitis. Number 4, psoriasis, chronic inflammatory disease marked by red patches covered with silvery scales caused by an overproduction of skin cells that replicate too fast. What else? Autoimmune disorder, not contagious, can be triggered by stress, cold weather, medications, or injury. Its appearance, its symptoms, well, thick, scaly, raised plaques, okay, commonly on the elbows, knees, scalp, and lower back. Itching, burning, or soreness may occur, often appears in cycles, flares, then calms down. Key points to remember: that it's chronic and reoccurring. Estheticians do not treat psoriasis. You definitely want to refer your clients to a physician. Contraindications would be avoid aggressive treatments on affected areas. And for number 5, we have Tinea versicolor, which is a superficial fungal yeast infection of the skin that causes uneven skin color. Lighter, hypopigmented, or darker, hyperpigmented patches on the skin. What are some of the causes? Well, caused by an overgrowth of yeast that normally lives on the skin, grows more in warm, humid, or oily conditions. Tinea versicolor, it is not contagious. Its appearance, symptoms: small discolored patches on the chest, back, shoulders, or arms, can be lighter or darker than the surrounding skin, may be dry or scaly, but usually not itchy or painful. Patches may become more noticeable after sun exposure because the affected skin doesn't tan evenly. Key exam points to remember, you guys, is that tinea is fungus, even though this one is yeast based, okay? Known for uneven pigmentation, versicolor, various color. Now remember that it is not the same as Tinea corporis, which is ringworm, or Tinea pedis, which is athlete's foot. Quick reminder that this is a 2-part video, so make sure that you go back and watch part 2. How to remember? Well, again, versicolor means many colors, or think many colors, light and dark patches. Think of it as a yeast imbalance that disrupts normal skin tone. Number 6, Milia. Milia is small, firm, white cyst under the skin filled with keratin, not sebum. Cause: it is trapped keratin and dead skin cells beneath the surface. Not related to oil production or acne bacteria. Can appear after trauma to the skin or because of the use of heavy, thick products. Appearance, symptoms: tiny white pearl-like bumps under the skin, most commonly around the eyes and cheeks. Milia is harmless, not red or inflamed, and also not painful. But milia does not or do not show any signs of having an opening. Key exam points: not acne, not comedones. Safe, and it is non-contagious. How to remember it? Milia, think milk spots, tiny white bumps that look like grains of rice or pearls. And again, remember that milia is filled with keratin and not oil. Milia. Number 7, sebaceous cyst, Steatoma, a large sebum-filled cyst within a sebaceous gland, considered a benign tumor of the sebaceous gland. Cause: blocked sebaceous duct traps sebum inside the gland. Can be genetic or from chronic blockage of oil flow. Appearance: symptoms: it can be round, movable lump under the skin, common on the scalp, neck, and back. Can grow large but usually not painful unless infected. Again, it is filled with thick, cheesy sebum. Key exam points to help you remember that a sebaceous cyst steatoma, it is also called a WIN, a benign, non-cancerous, but may need surgical removal if large. Estheticians do not treat, and you should always refer to a physician. Number 8, let's talk about nevus, which are moles or birthmarks. A pigmented skin lesion that may be flat or raised, commonly called a mole or birthmark. Cause: overgrowth of melanocytes, which is the pigment producing cell. You knew that. Usually present at birth, congenital, or develop later in life. Appearance: symptoms can be flat like a freckle or raised and flesh colored or dark brown. Usually harmless but can change over time. Found anywhere on the body. Now, key exam points to remember: most are benign, meaning they're non-cancerous. Important to remember the ABCDE rules, warning signs of melanoma. So things you're looking for is A, asymmetry, B, for border irregularity, C will be color variation, D will be for diameter. Anything that is larger than a pencil eraser should definitely be considered looked at. E for evolving, changing in size, shape, or colors. Estheticians do not diagnose. So again, if you ever come across something that may look suspicious, always refer your clients to a doctor if anything suspicious changes in appearance, or if you notice something strange. Even for yourself, you guys, you never know. Better safe than sorry. Number 8, again, nevus, mole, or birthmark. I hope you're still with me because you definitely want to remember all of these. Number 9, actinic keratosis. It is a precancerous, rough, scaly lesion caused by chronic sun exposure. Cause: once again, overexposure to UV radiation damages skin cells over time. Most common in fair-skinned individuals, especially older adults. Appearance: symptoms: rough, dry, scaly patches. Can be pink, red, or brown, usually on sun-exposed areas such as the face, scalp, ears, hands. Often asymptomatic but may itch or sting. Key exam points to remember: considered precancerous, can develop into a squamous cell carcinoma if untreated. Estheticians do not treat, must refer to a doctor. Sun protection and monitoring is key. How to remember it: actinic, think sun-related. Rough, scaly, potentially dangerous, think pre-SCC, which will be pre-squamous cell carcinoma. And number 10, let's go over skin cancers. Number 1 will be basal cell carcinoma, BCC, light pearly nodules that grow slowly. Cause: overexposure to UV radiation. Appearance: symptoms: smooth pearly bump, sometimes with tiny blood vessels. usually on sun-exposed areas. Once again, face, neck, ears. Key exam points to remember. Basal cell carcinoma is known as the most common skin cancer, and it is the least severe, the least aggressive, rarely spreads. Okay, that would be basal cell carcinoma. Number 2, squamous cell carcinoma, SCC. It is described as scaly, red papules or nodules, more aggressive than basal cell carcinoma. Cause will be UV exposure, chronic sun damage, sometimes chemical exposure. Appearance, symptoms, red crusty or scaly bump. Can bleed or become ulcerated. Usually on sun-exposed areas, once again, hands, face, ears. Key exam points to remember. Obviously, we said that it is more serious than basal cell carcinoma and may spread if untreated. Okay, that would be squamous cell carcinoma. Once again, think red, scaly. Number 3, malignant melanoma, which is the most serious, the most severe type of skin cancer. It is characterized by irregular dark patches. Cause, UV exposure, genetics, moles that change over time, which is why it is important to get checkups every single year. Appearance, symptoms, dark irregular patches or nodules, uneven color, asymmetrical shape, may bleed, can appear anywhere on the body. Key exam points for you to remember that once again, it is the deadliest, okay, the most serious form of skin cancer. Early detection is critical. Quick memory tips again: BCC, basal cell carcinoma, pearly and common, least dangerous. SCC, squamous cell carcinoma, think scaly and serious. Melanoma, think dark, irregular, and it is the most dangerous. And there you have some pictures so that you can have a good visual reference to go by. All right, you guys, I think that's it. That is it for this video. I hope you found this helpful. Let me know in the comments your thoughts if you found the information helpful and if you're currently studying for your state exam. Once again, thank you so much for watching. Thank you for your continuous support. Just know that it does not go unnoticed. If you found the information helpful, don't forget to give this video a thumbs up, share it with a friend, share it with someone that is also studying and could find this information helpful. Follow me on all social media platforms as Glam and Beyond. If you have any questions, feel free to reach out to me, glamandbeyondinfo@gmail.com. I'm going to invite you once again to check out the Estheticians playlist for lots of educational resources, not only state board related things, but definitely other protocols. So definitely check it out. You just simply have to scroll through all of the videos. There's lots and lots of videos out there that you can definitely find useful. Now let's keep going, let's keep growing, and I'll see you on the next one.